Hello everyone and welcome back to MediInsights. Today, we dive deep into the world of Tramadol tablets. In this video, we explore their use, correct dosages, mechanism of action, potential side effects, and essential advice for safe use. Stay tuned for an informative breakdown to empower your healthcare choices today. Use of Tramadol tablets. Tramadol tablets are primarily prescribed as a pain reliever for moderate to moderately severe pain. They are used for managing acute pain after surgery, chronic conditions like osteoarthritis, back injuries, and even certain types of cancer-related pain. Their ability to modulate pain perception makes them valuable when non-opioid medications are insufficient. Next, dosage of Tramadol tablets. Dosage varies based on individual factors such as the severity of pain, patient age, and previous opioid exposure. For immediate-release tablets, an initial dose may range from 25 to 50 milligrams every 4 to 6 hours as needed, with a common maximum of about 400 milligrams per day. Extended-release formulations are typically taken once daily. Always adhere strictly to your healthcare provider's prescription, as improper dosing may lead to adverse effects. Next, mechanism of action of Tramadol tablets. Tramadol is a centrally acting analgesic that works through a dual mechanism. It binds weakly to the mu-opioid receptors, reducing pain signals, while also inhibiting the reuptake of norepinephrine and serotonin, neurotransmitters involved in pain modulation. Its active metabolite, OD-methyltramadol, further enhances these effects, offering a balanced approach to pain relief. Next, side effects of Tramadol tablets. While Tramadol can be highly effective, it may also cause side effects. Common reactions include nausea, dizziness, constipation, headache, and drowsiness. More severe effects, although less frequent, can involve respiratory depression, seizures, serotonin syndrome, and the risk of dependency. Patients should be mindful of symptoms that worsen or do not resolve with continued use. Next, important advice for using Tramadol tablets. Use Tramadol strictly as prescribed. Never adjust the dose on your own. Avoid alcohol and other central nervous system depressants while taking this medication. Inform your doctor of any history of seizures and discuss any other medications you're taking to avoid dangerous interactions. Always taper off under medical supervision to prevent withdrawal symptoms. By end of this video, we hope you gained a thorough understanding of Tramadol tablets, from their uses and dosages to mechanism, side effects, and essential safety tips. Remember to consult your healthcare provider for advice and safe pain management.